The Ebola alert has prompted the Dallas County Commissioner's Court to call an emergency meeting for 2 o'clock tomorrow afternoon. The sole item on the agenda is to request a disaster declaration from the state of Texas.
Heather, the man who's been on the front lines of the Dallas Ebola fight from the beginning, is Dallas County Health Director Thompson. You've seen him here before over the last about 10 days. He's been here a lot. We appreciate that. Yeah. All right, let's talk about this disaster declaration, what it allows you to do, if you get that.
Well, I want to thank Commissioner John Wiley Price for bringing that forward, and Judge Jenkins and the Commissioner's Court in terms of looking at this. This should have been done day one. This issue will allow us to expand in terms of funding that can come to Dallas County and get more resources. So it's critical. If everybody remember what happened with West Nile virus, there was a great debate of aerial spraying, ground spraying. Mm-hmm. Well, you see how tough it is to make decisions. And today or tomorrow, it'd be great to see this passed.
And looking at what happens during one of those emergency management declarations disasters, the governor gets a lot of juice at that moment, right?
That's right.
It looks like almost all the calls the governor can make on what happens.
Well, you have to. When you look at the 48 initial contacts that we had with Mr. Duncan, including his Louise, his girlfriend, and the other family members, to date, none of them had tested positive. Right. They're asymptomatic. Now you have another group, which is the 77, or that number might have been reduced some in terms of contacts to the healthcare workers. That's significant. So when you look at it, all of these individuals should have been treated the same. Just like Louise had to stay in her house, everyone, including the healthcare workers, should have that same requirement.
And total number of contacts, do you have a specific number?
Early on, they're saying 77 in terms of the healthcare workers. Yes. That might have been reduced here lately, maybe down to 50. So we go from 50 to 77, the original number.
And some are falling off Sunday based on 21 days following their contact.
Right, that 48 will fall off pretty much completely.
All right. My understanding, there are some samples in Austin right now from healthcare workers being tested for Ebola, so there could be more soon.
Right. I can't confirm that in terms of actual samples. Samples are going daily or as they test, but I'm not sure that there are any that's gone down today. I can't confirm that.
Okay, let's talk about Amber Vinson. She cared for Mr. Duncan. We know what happened. She says she called the CDC, got permission to fly. If she had called you, would you have given permission to fly?
I would have said, you need to stay at your home, just like Louise has to stay at her home. We have a control order on Louise and her family, the initial 48. Now you have a 77 in terms of contacts associated with presbys, healthcare workers. The issue is the healthcare workers are on the front line. We have to listen to them. We got to protect them. And right now, it doesn't appear that we have our game plan together. So with this particular court order on tomorrow, we can get our ducks in a row. It's not that we've had missteps. It's just that you can't have Atlanta and Dallas having a disconnect.
Right. Let me ask you something. Does that mean it's totally local control at that point?
Well, it should be. And under the management plan, it will be local control, but you still have to get guidance because you still have CDC. Yeah, CDC, guidance. Right.
Okay. I do want to talk about this disconnect. Let's play that interview again with the director of the CDC. And you tell me who he's throwing under the bus here. Listen to this.
The second healthcare worker reported no symptoms and no fever. However, because at that point she was in a group of individuals known to have exposure to Ebola, she should not have traveled on a commercial airline.
All right, so is he throwing her under the bus? Is he throwing the CDC under the bus? Is he throwing gate workers under the bus? Is he throwing you under the bus? He's angry about it.
Well, I know Tom Frieden. He's visited Dallas County Health and Human Services. I respect him. But here's the deal. We got a top doc, Dr. Perkins, our medical director. The question should have been directed to Dr. Perkins. And so when you take the situation out of the local hand and you begin to ask other people, that is a challenge. But clearly, we have a process in place where you have people who are under control orders, you're telling other people not to leave, then that should apply across the board. And it didn't happen in this case for whatever reason.
Got it. And just quickly, he again said she didn't have a fever, but we know she was 99.5. Explain why that's not a fever.
Well, it's a fever. I don't know why. Bottom line is, she's a contact. She shouldn't leave, and she is the closest contact to Mr. Duncan. than anybody
so
else.
This whole thing of she didn't have a fever, and that's one reason she didn't read. Okay,
Well,
I feel you.
Well, let's hope they get it right.
Yeah. Generally, I saw you nod when I mentioned this is at least creates a loss of confidence. When there is a loss of confidence in the community as far as what's happening and how they're being taken care of, what does that cause? What challenges that?
Well,
pose?
we got some great hospitals here in Dallas County. Parkland, Methodist. We have great institutions. And so we cannot afford to continue down this road of these missteps. And so clearly on tomorrow, we'll move forward, but we can't have decisions made. We got to include our top doc in these discussions to ensure that we got a local perspective and not a national perspective, because at the end of the day, it falls back on Dallas. Everybody will go back to Washington, to Atlanta, to Austin, but we still got to live here. We're debating whether or not we can even let the police chiefs know contacts in their cities. We're dealing with a lot of issues that we need to deal with locally. I don't need input from outside.
It sounds almost like you don't want that number. If you don't want them calling the CDC. You don't want Ms. Vincent calling the CDC. You want to call on you. You don't want the CDC saying, call us, ask us for what you ought to do.
I want them to call a top doc, Dr. Christopher Perkins.
Really?
The medical director, Health Authority for Dallas County Health and Human Services.
So if you had a choice, you'd say CDC, you're in the back seat.
Well, we accept your guidance, but we got a top doc in Dallas.
I got it. I don't know. It's been a couple of weeks since we talked about this, and you told me maybe 10 days ago that you would like there to be a moratorium on flights coming from Africa, the infected nations for sure, infected countries. You still with that?
I still feel that way. I feel it for two reasons. One, West Africa, while I have all respect for the African countries, they don't have 21st century medicine. I stated that up front. I trust our doctors, our nurses on this side, the 21st century model, and that's critical. And so we have to look at that 21-day period. But again, I'm going to point back to 48 initial contacts to Mr. Duncan, none positive to date. Healthcare workers.
Those are the people you handled.
That's right.
Those are the people you handled.
That our staff, Dallas County Health and Human Services, CDC,
kept people in their homes.
Kept people in their homes, aggressively done. And so we have to look at it from a local perspective, get the local input and not a national perspective.
Did you get any pushback? There's a lot of, oh, come on, that's not necessary, moratoriums. The president even addressed it. Did you get any pushback? You get in trouble for saying that?
Well, that's fine. They can talk about it all they want, but we're in Dallas County. We got the first confirmed Ebola case in the U.S., and now we got 2 confirmed Ebola cases, and they're healthcare workers. I'm not listening to them.
It sounds as if, is something going to change tomorrow, do you think? Tomorrow everything changes?
I think the Commissioner's Court is clearly focused on moving forward and looking at what we need to do locally. And so tomorrow gives us that opportunity to not only make the local perspective, but also have the resources. Right now, they're saying 77, they're saying 50, these numbers change. Clearly, we got to be transparent. At the end of the day, we owe it to Dallas County residents and to the North Texas residents to be transparent and to be factual when we step up to the table and lay all the cards on the table. It causes distrust if we don't do it that way.
I think you get a lot of respect from people watching tonight. I think they agree. Zach Thompson,
thank you.
Thank you for coming in.